and welcome to the Maternity Unit at Vassar Brothers Medical Center, a highly specialized environment that offers the care and compassion of a birthing center and is designed around the needs of you and your family as you bring your baby into the world. The Vassar Brothers Maternity Unit is housed in the same building as our Level 3 Neonatal Intensive Care Unit, which is dedicated to the care of high-risk, premature, and ill newborns. Here, our maternal fetal medicine department provides specialized, compassionate care for families with a high-risk pregnancy. For all our pregnancies, our role is to help usher your newborn into the world in a safe and supportive environment with family-centered care. Let me show you around. When you arrive on the 3rd floor, the secretary will ask you a few questions such as your name, date of birth, physician, and why you have come to the unit. In advance of your arrival, your OB/GYN's office will have sent over your prenatal records as well as your pre-registration packet. When you arrive, you will be welcomed into our triage area where a nurse will do a quick assessment of your status and track your baby's heart rate and contractions using a fetal monitor. The nurse will contact your doctor to obtain information on next steps. The time spent in triage varies based on your condition. While in triage, you may go for testing, for example, an ultrasound. If you are in early labor, you may be given time to walk around on the unit to see if your labor is progressing. You may be admitted to labor and delivery, or you may be discharged home with instructions on symptoms to report to your physician. Once you're admitted to the labor and delivery floor, you will be in one of our private rooms with your own bathroom and shower. The nurse will review your birth plan with you and your partner. To ensure that your nurse can track your baby's heart rate and your contraction pattern, you will be on a fetal monitor using stretchable bands that wrap around your waist. This connects to a central monitoring screen so the nurse can see what is happening with you and your baby, even when the nurse is not in the room with you. We offer 24/7 anesthesia coverage, which can help with pain management. Your doctor will talk with you about pain management options. If you are a candidate for an epidural, the obstetrician will discuss this with the anesthesiologist. The nurses are wonderful at helping with non-medication pain management, including using birthing balls, positioning, and relaxation techniques. When the baby is delivered, there will be a nurse in the room solely dedicated to your baby in addition to your own nurse. The doctor or midwife may ask a technician to come into the room as well to provide some assistance. Your baby is placed on your chest, skin to skin upon delivery. This contact helps regulate your baby's heart rate, temperature, and blood sugar. If your baby is not able to go to your chest because your baby needs some extra attention by your nurse, the nurse will place your baby on the radiant warmer. We will need to weigh your baby prior to an hour of age, but can return your baby to your chest as soon as possible. After approximately 90 minutes, you and your baby will move from the labor and delivery unit to the mother and baby unit. If you have a cesarean section, you will remain on the same floor where we have 2 operating rooms. At delivery, your baby will be brought to the radiant warmer immediately for stabilization. As soon as your baby is stable, your partner in the OR is invited to come to the warmer. Then we will wrap and bring your baby to you in the OR. When ready, your baby can come to the recovery area to be breastfed. Infant security is a top priority for Vassar Brothers Medical Center. Before your baby leaves the delivery room, both you and your baby will be given matching security bands. The nursery nurse is in contact with your pediatrician and with the NICU if necessary. One of the most important things that occurs after your baby's delivery is the administration of medications that are required by New York State. Because these are mandatory, we give them to all babies. The first is an eye ointment, erythromycin, that protects your baby from eye infections. The second is an injection of vitamin K, which promotes blood clotting. This is not a vaccine, it is a vitamin. Once you move to the postpartum unit, we do recommend that you get the rest that you need for your recovery and to allow time to bond with your newborn. You can order room service from a menu that reflects the diet ordered by your doctor. During the stay, your partner can order from this menu as well. If you have allergies or dietary restrictions, our kitchen is trained to accommodate this and ensure you receive the right food. Some people choose to bring food from home, and this is fine, as long as your doctor has ordered a regular diet. During your postpartum stay, the staff will spend time with you, providing education to ensure you care safely for yourself and your baby. All nurses are well trained in breastfeeding and can provide assistance if you choose to breastfeed. In addition, we have lactation consultants 365 days of the year to support families that need some extra help with breastfeeding. The length of stay is 2 days for a vaginal delivery and typically 3 days for a cesarean section. During your stay, we provide diapers, blankets, and wipes for your baby. You are more than welcome to bring a lactation pillow or other items. We have a nursery area where your baby will go for the first physical assessment by a nurse. The nurse will be in touch with your pediatrician regarding any needs your baby may have. Your baby will be seen by a pediatrician within 24 hours of delivery. We encourage rooming in, allowing your baby to stay with you so you can learn your baby's particular cues for feeding. If you need an opportunity for rest, your baby can spend some time in the nursery, which is staffed with a nurse 24/7. Here, at Vassar Brothers Medical Center, we know that the birth of your baby involves every member of your family: parents, grandparents, siblings, and other loved ones. Our family-centered approach is designed to help every one of them bond with your newborn.